what time it is. Marvin Devine, Huber, Axel, and you know how we do. Yeah, I got the juice. Whip game cool, make them look like cool. Always play it cool, that's the biggest rule. Forget what they doing, keep on doing. I've been making loot since like 22. Ask me how I made it right here in the booth. I'm always pursued cause of what I pursue. That's greatness, yeah, I gotta make it, I got things to lose. Boy, wanna get in my crew, but you can't get in my crew. Me, Axel, and Huber, way too fireable. When this joint drop, better call the troops. And when you hear the drop, better raise the roof. Better raise the roof. You already know what happens when we link up. Let's go. Yeah, I got the
Good evening, good afternoon, and welcome to Kidney Hub East Africa, the space where truth is spoken, lives are changed, and hope is never lost. I am your host, Steve the Kidney Nurse. Welcome. And today, I am joined by my incredible co-host, as always, Moses Kennedy, known to many as the Kidney Ambassador, and renal nurse Tabitha Matikwa. And today, we are not just having another conversation. That's not what this is. We are telling a story of pain, of warning, of survival, and of strength. We are honored to welcome our guest, Mary Shiku, a nurse, kidney health advocate, and a true heart and kidney warrior. Now, Mary's journey has been marked by diagnosis, denial, heartbreak, and ultimately dialysis. But through it all, she is still here, still standing, and ready to share a message that could save your life. So stay with us, because this is more than an interview. This is a moment. This is a testimony. This is Kidney Hub East Africa. Now, before we bring our co-host and Mary on, we got to do the regular medical disclaimer. We don't want people to think we trying to give medical advice. You know, they say, oh, Why are you saying that? So the information on Kidney Hub East Africa is provided for educational and informational purposes only, and not intended or implied to be a substitute for professional medical advice, diagnosis, and treatment. Now, with that out the way, let me bring on our co-host, the kidney ambassador and renal nurse specialist, Tabitha Matikwa, as we give them the VIP co-host intro. Brother Moses, Nurse Tabitha, how are you doing?
I'm doing very fine. Thank you.
Brother Moses, how's everything going with you today?
Yeah, it's fine. So great. Glad to be here yet another Sunday.
Now, let me ask you, how's the weather?
It's really hot at the moment. And during the day, it's scorchy hot.
Hey,
we are within the tropical Kisumu.
Right. It's the same over here. I know here in Washington, D.C., it's scorching hot. And for anybody watching that you're on dialysis, please watch your fluid intake, especially if you're a kidney warrior and you're in East Africa. And if it's hot there, definitely watch your fluid intake. What would you have to say about that, Nurse Tabitha?
For patients who do not pass urine, because there are those who have got a 0 drop of urine, you're not supposed to take more than 500 ml. Because if you do that, you're likely to get fluid overload, and it's always very bad. Your dialysis nurse have to remove 4 liters from you. You're overloading even the heart, which is already weak. But if you are passing some urine, let's say like maybe around a liter of urine, you need to replace. Maybe you can take even up to 2 liters. So it depends on how much you are passing, how much urine you are passing. You should be very careful so that you don't also get fluid or overload. Again, if your urine has not changed, you should not restrict yourself so much so that you don't get dehydrated. Yeah.
Okay.
Thank you.
Okay. Oh, you're welcome. So let's bring on our guest. Ladies and gentlemen, please welcome Mary Shiku to the show. Hi, Mary. Welcome to Kidney Hub East Africa. How are you doing today? Your mic is muted. There you go. Mary, how are you doing today?
Hello,
We can
I'm
barely
good.
hear you. Can you talk a little louder?
I'm good.
You good?
Hi,
Hi, how you
can you
doing?
hear me?
Yes, we can.
I'm good. I'm good.
Mary, thank you for coming on the show today.
Thank you so much for this platform.
Great. So, Mary, can you just tell us a little bit about yourself, where you live, what you do?
Okay. Again, my name is Mary. I'm from Kikuyu. I'm a nurse and a kidney health advocate, a kidney warrior and a heart warrior.
Okay. Okay. Now, Mary, take us back to when you was first diagnosed in 2022. What do you remember most about that moment when you was diagnosed back in 2022?
Okay. Unlike other patients, mine was a little bit different because I used to have recurrent anemia from high school, and I never knew what was the cause of anemia. In spite of her taking hematinics, the anemia would recur every time. But again, one doctor told my mom when I was in high school, they need to know where the blood is disappearing from. So, but we assumed the what the doctor told us. But taking you back, my dad passed away because of kidney failure, and we never knew it's because of what. And when he was passing, that time dialysis and kidney health was not evolved, so they never knew the cause of the kidney failure. But also he had a problem with anemia because when I was small, I was done an open heart surgery, and they needed someone who can donate blood. So he could not donate blood because he had low HB, low hemoglobin. So we assumed the fact that we were told to know, to test and know where the blood the blood is going. So in 2022, after having recurrent anemia, I decided to take myself to the hospital. That time I was a student, so I just took myself to one doctor. I told him what was going on, and then he told me we do kidney function test. And then when we did the kidney function test, I think creatinine was 282, urea was 15, so it was not that bad. It was in its first stage, and that time I was taking antibiotic. So we thought maybe it's dehydration or something. So the doctor told me to go to. So the doctor told me maybe it's dehydration, because when you look at me physically, I never looked like someone who has a chronic kidney disease. But then again, due to my dad's history, I took myself to renal unit, and there I met one nurse. I told her about my family history, and then I showed her the workups. So after I showed her the workups, she took me to the clinical nephrologist who was there. It was Nakuru PGH. So when I told the doctor, she never thought I had chronic kidney disease. She suspected acute kidney failure. So she told me, let us do kidney, urethra, bladder, ultrasound, so that we can know if it's chronic or acute. But at that moment, I got into denial again. So I never went, because I thought to myself, I'm still a student. I have too much on my table. So adding up to a disease, it's too much. And because I could not see any problem apart from maybe fatigue, I used to have a lot of fatigue, but I thought maybe it's working or something. So I just continued with my work. So at one point, the nurse who I had talked to found me at the ward when I was doing my clinicals. She told me, "Did you go for the ultrasound?" And I said no. So I think she suspected I was in denial. She took my number and followed me up. So she decided to make me get the KUB for free. Actually, she took me herself. So I went there, and then they did the KUB, and they found out that I had renal parenchymal disease, and it was both. So I had stage 1 chronic kidney disease. At the moment, when I returned the results to the doctor, she told me, because you are a nurse, I will tell you things as they are. So right now you are in your first stage, and I don't want you to get on dialysis. Um, so I want you to get conservative management. I want you to go to nutritionist, because from today you will not be eating the normal food. And then I want you to buy Renal Gold, Campo erythropoietin, and then go and see Dr. Kiapi. Dr. Kiapi was one of the best nephrologists at Nakuru level 5 that time. So after she told me that, again, I never took it serious.
So
So
let me
I
wait a minute. Let me stop you right there for a moment.
okay.
Help us understand what was going through your mind when you heard stage 1 kidney disease, chronic kidney disease. What was going through your mind when you heard that diagnosis as a nurse?
Okay. As a nurse, I never took it as a big deal, because obviously I know what goes around. But again, as a daughter whose father passed away because of kidney failure, and again in my family lineage, uh, father to my two sisters to my dad has also passed away due to kidney failure, and then the other two are on dialysis right now, and we have another two cousins who are on dialysis. So at that moment, what was in my mind, I never now reasoned as a nurse. I reasoned as a normal person. I started thinking, now I'm going to die. So I got again into denial. I never knew what to do. So at that moment, I remember I never went to class for 1 week, to a point even my mom was called. I got I started now praying, hoping that things can change. Maybe it's something that can be changed with prayers, because I thought now this is something spiritual or cultural, something like that. And then my mom and then even my mom told me that we should pray and don't believe in those things, because back then we used to think it's something cultural. You see, the way you were told that there are some things that were not done in the family, that's why you are having that disease. So I was waiting for my death to be sincere. Yeah.
So, Mary, you mentioned you went into denial after that diagnosis.
Yeah.
Help us understand what caused that denial. I mean, was it fear, shock, or not really understanding the seriousness of this situation?
I would say it was fear. I would say it was fear because and denial. Mostly it was denial because I remember I was called by our nephrology nurse. She was also a lecturer at our school, teaching us genitourinary disease. So even when she called me, she was also a counselor. So she talked to me and she told me to go to Dr. Kiapi with my uniform, that he's not going to charge me. But again, her also, she thought it was a misdiagnosis because she could relate with what she teaches us, and the symptoms I have, they were not really adding up. So I got into denial because at that moment, apart from anemia, recurrent anemia and fatigue, and maybe bloating, I used to have bloating, and sometimes nausea, but I never took it serious. I thought maybe I have hyperacidity or something. Actually, I used to have antacids in my house. So I continued like that with denial until 2024. Actually, when I was doing my final qualifying exams, the third paper, I went out because I had a diarrhea and vomiting. And then I still assumed it is food poisoning. So I continued, I finished school, and then I went and looked for work, and I started working. But when I was working at night shift, I used to have numbness from my hip. But then I assumed it is cold. So, and then every time I had menses, I used to have severe pain and dizziness. But I thought maybe it's normal signs and symptoms of dysmenorrhea. So I never took it serious. So I
Mm.
continued, yeah, I continued with my work 2024 until November 2024, when no October 2024, I decided to quit the work where I was working because I used to live alone. Then I decided to come back home to live with my mother when I started feeling I'm not okay. So fortunately, I had applied another work at my home place, and I got the work. But I started noticing weird symptoms like palpitations. And then I used to get exhausted so fast. I started sleeping at work. I started being unable to eat even a quarter of the food, vomiting, confusion. I could confuse even drugs. That was the worst part. So after 1 month, because I could not be able even to concentrate at work, I decided to quit the work. That was November 2024. So you see that moment when you're stressed and you need to have a break. I went to a friend, and then I was winding up, and then at that moment I started having difficulty in breathing. So as usual, I'm that person who knows how to assume things. So I never took it serious. I thought maybe even when I was having shortness of breath, I never took it serious. But then again, I went to the hospital, and then they took my HB, and HB was 4 at that moment. That was November 2024. So they said I need an urgent blood transfusion. And let me take you back before November 2024. In 2022, when I was told I have a first stage CKD, and I need to change my diet, I never took that serious. So I continued with my lifestyle. I continued to take sodas, fast food, and everything. Actually, I liked sausages so much and smokies. Yeah, so I continued to take them. So my lifestyle never changed. So that November 2024, um, after I was told my HB is 4, they said I need urgent blood transfusion, and that's when medical experience comes in, because now when they told me I need blood transfusion, I was not at home. I was somewhere far from home, very far from home. So I started thinking, if I get admitted here, it's going to be stressful. So I asked the doctor, can I survive if I stay today and then I travel tomorrow? He said it's okay. So I traveled back home. I called my mom. There was this hospital. They were saying it's a good hospital, Kijabe Hospital. So I told mom how I'm feeling, and I told her, let's meet at Kijabe Hospital. My mom came because before she could realize I was not okay, because even at this moment when I was between 2022 to 2024, from 2022 to 2023, I had gained body weight because I used to do the squats and everything, normal things that a girl does to have a good shape. So I really had a good shape that moment. 2023, 2024 January, February, but my weight started reducing. I started losing weight to a point my classmate could notice. So at 2024, I had lost like 20 kgs, November 2024. And then I started having discoloration of the skin. You see, when someone is light skinned, there is a way you can easily notice when they are darkening. So even at that moment, my mom could tell me, you are darkening like the way your father was darkening. And at that moment, my HB is 4. So my mom decided to come. We met at Kijabe Hospital. And then when I was told, when I went there, because I have knowledge of, because I was a medic, I knew you are not supposed to get blood transfusion and you have CKD because of the potassium and everything. They need to be binded. So I had to tell the doctor my history, but at that moment I never thought it could have progressed to end-stage renal disease. I thought maybe I was in stage 3 or something,
So
because
I'm sorry to
Mhm.
interrupt you. Let me stop you right there for a moment because
Okay.
I had some follow-up questions and you just answered my you answered my follow-up questions about your symptoms and what happened between 2022 and 2024, and you shared anemia, because I was going
Okay.
to ask you what signs or symptoms were your body giving you. You mentioned it, bloating, uh, your anemia, your hemoglobin dropped down to 4. You needed blood transfusion, fatigue, and a lot of symptoms that you gave, nausea, vomiting. You said that you like pushed it aside and you didn't kind of, connected it to uh, CKD, chronic kidney disease. So let me just ask you my last question, because uh, Brother Moses and Nurse Tabitha have questions as well. So my last question is, in 2024, which you was just about to mention, this is why I wanted to stop you. In 2024, you were told you had end-stage renal disease. Help us understand what that diagnosis felt like. What was that moment like for you emotionally when you was actually diagnosed with end-stage kidney disease?
To be honest, I if I say this, someone will think I'm funny, but even right now, I was not shocked. I think it's because I knew at my first time when I was diagnosed in 2022, I was not surprised, I was not worried, but the person who was worried is my mom. My mom, when I was told I have end-stage renal disease, I think she thought I was going to die. So she just went out and she started crying. And at that moment, my mom started looking disoriented. But me, I was okay with it and I was ready for anything. I think God had prepared me for anything because I remember when I got admitted, I told my sister to bring a pastor and I confessed my sins and I was ready for anything. Yes.
Hmm.
Yeah.
Wow. Wow. Brother Moses, I know you had some questions you wanted to ask, so take it away. Unmute your mic.
Can you hear me now?
Yes.
Yeah.
Thank you so much, Steve. Thank you so much, Tabitha. And thank you so much, Shiku, for showing up. In fact, for honoring our invitation. I want to assure you that we don't take it for granted. So we are very proud. You represent other warriors wherever you are. You are a source of inspiration, okay? So let me just go to question number one. You shared that your dad, you shared that you did not start dialysis right away because you were misled by someone claiming he could restore your kidney.
Yeah.
What made you trust that person?
Okay. First of all, you see, when you hear you're going to be done dialysis, it's not the best option. And to be honest, even as a medic, right now is the time I'm experiencing people who are on dialysis and they are okay, they are stable. You see, at my time when I was in the hospital, I used to see people who are on dialysis, they are so critical. So I started imagining myself, but that was not the point. One family member told me that he has this one doctor who comes from Germany and he has a lot of experience. She told me that the doctor says my problem is hormonal. So if he does hormonal therapy, it's going to rejuvenate my kidneys and they are going to get back to normal. And then at that moment, it was my first time to be admitted as an adult. So I never liked the environment of admission. So the moment you're told, you see, this is something new to us, and we can't deal it with just my mom. When it comes to this situation, you need to invite other parties because of the bills and everything. So when they told us, they convinced us that dialysis was not a good option. They said people don't survive more than 2 years with dialysis, and this person is going to rejuvenate my kidneys, and I'm going to get back to normal within 6 months. And then again, she said that with dialysis, it will be hard to even pursue my career because of the 2 days and everything. So I decided to believe them. You see, when you are sick, you can seek for different opinions. So I remember that moment, even the nephrologist told me that I cannot be discharged because my potassium was so high. So you see, they had the fear of cardiac arrest. So we had to sign leaving against medical advice so that in case anything happens, they are not responsible. So we went to that doctor. He was asking for 1.5 million. So we went and we started the therapy. You see, he was a Luo man, and they with they know how to convince people. So we went, and he said the therapy will be for 6 months, and it is injections. I I can't tell you if it was a brainwash, because I can't understand even right now, because there were no license, there were no medical equipment. It was a corporate building. But then again, I I continued. I don't know if it was urea or something that was confusing me. I don't know. But what I know is, we started the therapy. It was infusion. I used to get the infusion once a week, and we paid a deposit of 500. He said the others we can pay in installments. So I used to go, and after I get the injections, I used to feel numbness. I used to feel like I'm not okay, like a mad person. You see, I remember my mom used to massage me with warm water every night. They used to exchange shift with my sister. I used to cry every night because of pain, because of numbness. I felt like I was not okay, confusion and everything. You see, the sad part is, he used to tell me to eat the things I'm not supposed to eat, like avocados, bananas, milk, yogurt. And you see, I have high potassium, but the good thing, I had an output. So that's a good thing. So maybe it was helping somehow. And then we continued for 3 months until I got worse. I started now having, I remember before that, when I started having, like, I'm not okay, he said that, like, I am not mentally okay. So the family member who has taken me, I don't want to say the name, said she's a counselor, she's going to counsel me. So we continued with therapy, and then I started having uremic frost. And from my knowledge, I know uremic frost, you get it when the urea is so high. So I told him, why am I getting uremic frost if the therapy is working? And he said, no, that is not uremic frost. That is a sign that you are healing. It's urea coming out. So it's a nini. And you see, when they used to do the lab test, the urea could have low readings. So I think they used to edit them, to edit the results. And at first, when I went there, he said, you see, when I was at Kijabe Hospital, they said I'm at GFR of 2. But I don't know what he did and where he got those results, because they were from the University of Nairobi. You see, when you see University of Nairobi, you trust the results. So he gave me results of University of Nairobi. He said my GFR was not 2, it was 65. So he said that is a good sign. And the one for Kijabe was a false one. And he convinced me, look at you, you don't look bad. So how can you have a GFR of 2? If you have a GFR of 2, you could not even be walking. So that was a convincing part. So I continued with therapy. At one moment, I remember he said that some hormones, because it's a problem with hormone, that's why I get angry so fast and all that. And you see, my mom could relate, and the family member, because I used to be furious every time, but I think it was urea. And so I continued. until one moment I started having a puffy face. But instead of seeing a puffy face, he used to say that my face is becoming round. So it's a good progress. We had an argument to a point. Every time they could have a discussion, I was not there because I think he started suspecting me because we used to have arguments because what I'm taught and what he's telling me, they are two different things. He said that he even have arguments with Nairobi hospital doctors because he got a different experience in Germany, and Kenyan doctors don't want to embrace his new technique which works in Germany, Spain, and everything. He said he has even gone to China. So, and he used to say he works at Kenyatta Hospital. Yeah, I forgot that. He used to say he works at Kenyatta Hospital. So you see, he had so many reasons to convince us. So me, I decided to give it a benefit of doubt because he told me at one moment, stop being a medic and become a patient. And let me do my work. You will see the results after 6 months because dialysis. This therapy is better than dialysis because the dialysis is going to give you a lot of organ damage, and my therapy is going to be for 6 months and you'll be okay and you can go back to work. So I decided to give it a try. I continued for 3 months until I got worse. I started having again difficulty in breathing. That's when I
Okay.
went to that's when I went to PCA Kikuyu Hospital, and they did an X-ray. When they did an X-ray, I had cardiomyopathy. I had pleural effusion. So at that moment, uh, that sonographer told me I need to go back to the doctor because I need admission because already I have fluid in my lungs. So, but I told him I have my own doctor. He is the one who sent me for the X-ray. At that hospital, uh, I had a friend, a nurse friend. So I called her. So I was really bad at that moment. So after the X-ray, I sent it to this doctor. After I sent the X-ray, I think the doctor noticed things were not okay. So he never responded. So my friend who was a nurse took me to the maternity ward because there was an empty bed. She told me to relax there. And at that moment, she was encouraging me, telling me, please, Shiko, from the story you are telling me, that doctor is a quack. And you see, at that moment, it was around 12 p.m. We are waiting for the doctor to respond, but he's not responding. Actually, he went, he switched his phone off. But I had
Okay.
hope, yeah, but I had hope he will open the phone. He will switch on
Okay.
the phone.
Okay. Let
So
me
we
interrupt you
continued.
a while shortly
Okay.
for answering that extensively. Actually, I
Okay.
was to ask you the next
Mhm.
question. Were you desperate for a cure at that time? But then, uh, from the conversation we've had, you've answered that. So just allow me to go to the next one, okay?
Okay.
Yeah. What what would you say now to others who may be tempted by similar false promise?
I would say, first of all, if you have CKD, there is no other way. It's either dialysis or transplant. Because I I have not even mentioned other people who tried to convince me. There are those people who called themselves online doctors, something like that. They say they have supplements, things like supplements. I had also gone to I was also taken to a herbalist. And they will tell you the same thing. They will rejuvenate your kidneys and everything. But the one advice I can tell my viewers and everyone who watches me, because I do kidney education, please, if you have chronic kidney disease or acute kidney failure, acute kidney injury, there are two options: either dialysis, either a transplant, or maybe if you are in first stage, you can be given conservative management. But that one you will be given by, you have to be advised by a nephrologist. You can't, even a normal doctor, a general doctor cannot treat you kidney failure. He will take your history and then refer you to a nephrologist. So anything that is not from a nephrologist, don't listen to it, because they will just waste your money, and you will
Absolutely.
eventually end up in dialysis. Yeah.
Absolutely. Thank you so much. Then let me just add one more. Uh, how did the delay in proper treatment affect your health?
It affected my health because you see, like right now, I don't have so much symptoms that people have, because personally I don't have diabetes, I don't have high blood pressure, I don't have any autoimmune. It's something genetic, which was not they have never discovered which kind of genetic disease I inherited that affected the kidney, but after biopsy they concluded it was structural diseased kidney. So pardon. What did it-
Oh, okay. Seemingly, uh,
uh-huh.
you did answer that a bit. Let me just drag you to another question.
Uh-huh.
Uh, what what was it like when you were told that you had developed heart failure?
Okay. Oh, I know. I remember your question. The complications that I got if I had not gone to other managements. I think if I had started, let me take you back. I think if I had I had seen the nephrologist at 2022, I would, taking biopsy sample would have been even easier, because even when I did a biopsy, it was limited because I had already started dialysis. And the kidneys were a little bit small because they had shrunk because of dialysis. So me, I think if I had done biopsy, um, if I had done, if I had started treatment in 2022, I would have avoided dialysis first and maybe seek for a transplant before I had started dialysis. Secondly, I would have known the cause really well. And then
Absolutely.
thirdly, I would have avoided heart failure. And this heart failure was caused by the quack doctor. Because when I was doing my echo ECG at Kijabe Hospital, I never had heart failure. So it was triggered by this doctor. And right now, what is making me to go to India, or rather, what is causing me to seek for high specialist hospital for transplant, it's because of this heart failure. And what makes me to use a lot of
It seems like we may have lost Mary. Brother Moses, are you still with us?
Yes.
All right. Maybe her internet connection could be. Did she come back? Mary?
Not yet. Not yet.
All right, everyone. We're experiencing technical difficulties. Hopefully, we'll get Mary back. Brother Moses, you can reach out to her, see if she can come back on.
All right.
Tabitha, I know you just joined the conversation, but I'm sure you heard everything that Mary was talking about in her journey. As a nurse yourself, do you see these type of situations with other nurses in Kenya that may be diagnosed with a chronic condition but not take it serious and be in denial and possibly seek out herbal remedies or other concoctions that say they can heal your kidneys? Is that a common practice there?
It may not be necessarily nurses or healthcare workers, but most African, it's like if someone dies, they have died because either somebody bewitched them. So again, also, if someone is sick, you are sick because this and this has happened. So by the time someone comes to seriously seek for support, they have tried to look for other support somewhere else. They have explored the issue from the family, and when they call other family members, they might be taken to the either herbalist or the witch doctor or wherever, so that they can try and get a cause, the reason as to why we are where we are. But one thing that has really come out so nicely with she's brought out nicely the issue of denial. And just as I keep repeating many times, denial is refusal to accept the truth. And it's actually a defense mechanism where a person refuses to fully accept maybe their diagnosis or even the severity of the condition. And this is because as the diagnosis has come, it's a bit traumatic, it's overwhelming, and it can also be very, very much frightening. And it is presented by someone now refusing to either medication, either to start dialysis, or even refusing the prescribed diet. And also people keep seeking opinion here and there. And the impact of denial, yes, someone may be shocked. And even as a person is shocked, there is delay in starting the treatment. It can lead to poor adherence and actually poor outcome, just as you have seen whatever our sister has really gone through. As she was in denial, this is where she got somebody along the way who took advantage of her, telling her that you can get well. But this happened because she was actually in denial, or she was trying to look for a way maybe not to get into dialysis. So if you are dealing with someone who is in denial, avoid accusation. Try to look for a way to support them, help them understand the severity of the condition. Like when someone comes with high urea, high creatinine, let them understand what are the normal values of the urea, what are the normal values of the creatinine. When they are this high, what is happening to the body? Yes, someone may not be seeing like there is any change in the body, but when you explain to them, when the creatinine and the urea are this high, this is what is happening, you are helping them to understand. Yes, validate their feeling, but now guide them, gently address what you can see. For example, if someone has missed the medication, you can address it. If someone has missed the appointment, you can address it. Yes, I send you for an ultrasound. You have not brought. Why? You need to support them, address their fear, their anger, and even the grief, and the fact that they have been told that the kidney is not working. They're already in grief, and that is why they are in denial. Send them for professional counseling so that they can understand all about the kidney disease. Connect them with other renal patients. When you connect them with other renal patients, they will tell them, okay, I've been dialyzing for the last 2 years or the last 5 years. I'm okay. I'm able to continue with my work. I'm able to continue with my every other day. So thank you, Brother Steve. I was just trying to address something small about the denial. Thank you.
Absolutely. You did very well. Brother Moses, please continue with your questions. But Brother Moses, one question I want to ask you. Tabitha mentioned once you identify, denial, to seek professional counseling. How practical is that for the average kidney warrior in Kenya to go seek counseling?
Well, that's the ideal situation. But then when you escalate it further as to how and when and in which form you want to do it, then there could be some hurdles ahead that you must also attend to case by case. For example, if you are in denial and you've sought some professional advice, then what happens? It means you need to prepare yourself, both mentally, financially, and move forward towards that. So yes, the key thing is first to identify the right move, the first move. Yes.
So I hear that, but basically what I'm trying to get to is that affordable for most kidney warriors in Kenya to seek professional therapy help when you said the NHS or the insurance provider over there only covers for dialysis and consumables and labs, but not any other extra services? So if one wanted to go seek professional therapy for its mental health, they would have to pay out of their pocket?
Definitely. Unless you seek such services or follow-up services at referral hospital, and again, you are met with a serious hurdle in terms of how checkoff and layoff systems work regarding social health insurance, where you can get such services and catered for by the health insurance, the government insurance, is just by being admitted to the hospital. But again, the question is, do you need to be admitted for just counseling, professional counseling? No, these are services that need to be outpatient. But then, if you move to level 6, level 5, sometimes that is where you will get the right people like Tabitha to take you through. Why? Because that is where most of them are stationed. But then again, the social health insurance fund does not cater for an outpatient in such facilities. So in brief, the shortest answer is you need to scatter out of your pocket, as most warriors do that. I don't know how Shiku does it, but let's hear from her also.
Right. And then after that, Brother Moses, please continue with your questioning.
So for me,
Sorry?
I paid for my counseling sessions. I have never gotten free counseling sessions. Yeah, and I did it once when I was admitted. From then, I have never gone to counseling sessions. Yeah.
All right, Brother Moses, please
Okay.
continue with your questions.
Okay. Now, let me add the last one, almost last one. Shiku, what was it like when you were told that you had developed heart failure?
Mhm. As I said, I was I was not surprised. I was ready for anything. So even at that moment, I was really bad because I was admitted for 1 whole week and I was on oxygen throughout. So at I remember there was even a time I held my mom's hand and I told her I can't do it anymore. So even at that moment, they had done a misdiagnosis because they were trying to know the cause of my kidney failure. So they thought it was autoimmune because I don't have diabetes, I don't have high blood pressure. So they suspected progressive systemic sclerosis. Uh, but when I looked at myself, uh, symptomatically, I never had the symptoms of sclerosis, systemic sclerosis. So they said that condition is rare, and I will stay maybe the people they have seen staying for many years. It's 45. So they told my mom maybe if she got married, maybe at 20, because at that time I was 26. Maybe if I get married at 27, 20, I will leave a child of 15 years. And then I was like, what is the need of even getting a child if I'm going to to pass on? So that moment, what I was worried about it because I had changed drastically. My I had changed physically, losing of weight. I had darkened, and then as a normal at my age, you see, I was at that age. I want to work hard, and at 27, that's when you plan maybe to get a partner after you work like 2 years or something. So I was like, hey, who is going to love me like this? So those are who what are the, what are people going to say when they see me like this? You see those psychological problems. But I had a good palliative nurse. Actually, we talk until now. I was that person who never wanted to open up to anyone. Even when I was going to dialysis, I was angry at everyone, including my nurses. And I could just go for dialysis back home. And I could just stay with I never interacted with people, even fellow patients on dialysis. I never wanted to listen to any advice. I never wanted to talk to anyone about my problems. So at one point I had good nurses. I had one nurse. He is my friend until now, my dialysis nurse, who continued to encourage me. Even my palliative nurse, they told me that you can be an encouragement. Start using your story to encourage others. So that's when they talked to me, and slowly I started opening up. Yeah.
Thank you so much. Thank you. Your words caps it all, my sister. Brother Steve, I'm done. Just back to you.
Thank you, Brother Moses. I appreciate that. We'll bring Tabitha up because I know she has questions as well. Sister Tabitha, thank you again for joining the show, for your expertise and wisdom and guidance. So you can go ahead and talk with Miss Mary on your questions.
Thank you so much. And this journey is it is wow. It has everything when you think about stages of grief, and I've been able now also to pick the anger part of it, and not only you, many patients also present with anger. I know I have seen a patient really abusing the health worker, or even abusing the spouse, and maybe they're angry with everyone. This anger stage is real, just the way you're presenting and telling us. And this anger happens sometimes due to loss of control, the unfinished business, the fear that is already inside you, where you feel like maybe you are at your career peak, you've just started working, you feel so disappointed, and this anger can actually come. And I usually say, even in that moment of anger, remember, let's say like your immediate caregiver, they're your source of support. Therefore, even if you're so angry with them, kindly be very careful so that you don't strain that relationship. If it is your mother, you have to be careful how you are handling her, because tomorrow you need her support. And this anger has pushed many away and away from their loved one, and some relatives have actually pulled away, not understanding it is because our patients are going through anger, and we need to support them. And I usually tell relatives and caregiver, even if you come and find your patient is so angry, tomorrow you might come and find their mood has lightened up. It's not because they don't want you. It is a stage. It's a stage of grief, even as they are coming to terms with the reality of the diagnosis. They need support from even the necessary others. So Shiko, um, as you started dialysis in 2025, maybe you can explain to us about the catheter insertion and even your first dialysis, and maybe what you really expected.
So at first, I was told I when I was in casualty, the first time I was admitted to be started on dialysis, I was so stubborn because I remember I told the doctor who was on casualty, me, I need you to do me blood transfusion, bind me, and let me go back home. I have a doctor back at home who is going to continue with his therapy. So I never consented for dialysis. And then at that moment, I had even uremic encephalopathy because I was acting so weird. So when I was started dialysis, I started with a temporary catheter. And at that moment when I was getting the catheter, when I found out that I was okay after the temporary catheter, I said, thank you, God. Then when I was starting on my first dialysis, because my first dialysis was started when I was on oxygen, and I had a lot of fluid overload. So I never thought that the first feeling when I saw myself coming out okay, I said thank you, God. And I remember the first one, they said they are going to do, they're going to remove fluid first. because they removed 5 liters the first day. And that feeling of you entering the dialysis, you have difficulty in breathing, your oxygen is at 60 or 40, and then you have a lot of struggle, and then coming out somehow relaxed, it is the one that encouraged me. And then slowly by slowly, you see people walking in and they are okay, they look normal, and you see them outside. You can't even say they are on dialysis because, as I said before, me, the one that I experienced at the hospital, they were always critical. So I thought I'll be at that moment. But me seeing, asking people, and they tell me they are working. Actually, the palliative nurse told me, and that encouraged me a lot, that we have even a doctor who works here and he does dialysis. He goes for dialysis and he works. But unfortunately, he rested. May his soul rest in peace. But that person encouraged me because I asked myself, if a doctor can do dialysis and then they work at the same time, then I have hope. Because you see that even that feeling of being a medic and then you are sick with a chronic illness, that also affects you. And then another thing, you are a counselor, at our age, it's so difficult to be diagnosed with a chronic illness because, as you say, that is the peak of our career. So you start thinking, you had dreams of having a family, a good career, and then it is affected by this disease. It's, I don't know what to say. It deteriorates even you mentally, because I thank God I was with mom because she understood me. When I wake up and I don't want to talk to anyone, she will understand me. And I stayed for like 8 months, going for dialysis back home. I never went outside completely. I never wanted even to work. I remember even nurses told me to go back to work, and I said no, I don't want to go to work because I started hating myself, especially because of my body size, and I I just wanted to stay at home because I started thinking, what do people say about me? And at one point, I had a suicide mission. I thank God I also have a clinical nephrologist who is so friendly, because he used to call me like 5 missed call to go for dialysis. I said to myself, if I miss dialysis for like 2 days, I'm not going to survive. So at one point, I missed dialysis for the first time, for the second time, and then the doctor was calling me nonstop, telling me, please come for dialysis. If you're not going to come for dialysis, it's not going to be, it's going to be bad. And then I'm like, just let me go. I'm tired. And then my mom is like, I'm doing all this effort and then you want to go. And I'm like, no, I just want to go. But God is great. I had a good team of nurses and doctors. So I think they played a big part of me getting into acceptance. So even when I see people going through that phase, I know you have to pass through that phase for you to come into acceptance. Yeah.
Thank you so much, Shiko, and you are really bringing it out so well. And I love the way now you brought out the issue of depression, being in low mood where you don't even want to go for dialysis. And I love that palliative healthcare worker who was there supporting you, and even your clinical is it your clinical nurse who was there calling you many times. I know there are patients I have really called and called again, and somehow they have survived and they are still they're still alive, because we make some effort to look for them. I haven't seen you for dialysis for some time. Where are you? It really makes a difference in their life, because all they need is someone who understands them. So if you have a patient who is on dialysis and who is refusing to go for dialysis, support them, encourage them, call them again and again. Avail yourself to take them for dialysis. Maybe it is your relative. Take them physically if they are refusing to go. Look for someone to talk to them. Look for a way to encourage them. Tell them this life it is doable, and that is why Shiko is alive, because somebody really did a serious follow up on her, calling her several times. That was really good. So, how, Shiko, how has dialysis taught you about resilience and survival?
Uh, Dialysis has taught me that you can survive with dialysis, which is something I never knew. Let me take you back. Even before, even at this moment, it is my clinical nephrologist, like the doctor, the dialysis doctor. He's a very good person because there are many times I used to tell him that me, I think this is cultural, so there's no need of doing dialysis. And I remember him telling me, "You're so young, you need to do transplant because even because of your heart." And I'm like, what if I go to do transplant and then those ancestral spirit attack me when I'm on transplant? And then the doctor is like, no, this is something genetic and you have to accept that it is genetic. You are inheriting a genetic a gene that has a pattern. And I used to argue with every doctor when I go for clinics. I argue with them. Eh, so it was a phase of acceptance, then going back to denial. So I would also say my mom has been my pillar because being strong for me, taking me everywhere. I remember even when I went back to work, she used to take me to work early in the morning until I became so stable that I can go on my own. So my mom has been, I could say, apart from the doctors, if my mom was not there, I could have not survived it. Even my mom has played a big role in my process of dialysis. Because again, the fact that my condition, they don't know the cause, that alone can affect me, because I'm like, even if I'm going to do transplant, what if what attacked my first kidney attacks my transplanted kidney? And then again, as a medic, they say having knowledge is good and is bad, because every time you're going to dialysis and you see something small, you are like, you are not maintaining sterility, you are not doing this, you are not doing this, and then you'll be like, you are arguing. So if a nurse is not understanding you, you will have a lot of problems. So even there are those moments I would come out of dialysis, I'm so angry. I don't want to go to dialysis again just because of the nurses. So I would say even having knowledge affected me mentally. So you would think someone who has knowledge, like you, Tabitha, like Steve, you will accept a condition so fast and your treatment will be better. But it's not the case. Otherwise, it's better someone who doesn't know. The one who is told by a doctor, take this medicine, and she believes in the medicine, that person can live so many years. But in my case, I will be like, why are you doing this and not this? Because I remember I was coming for clinics at Kenyatta, so I used to see you talking to us, Tabitha. And then I remember that after doing so much test and finally doing the biopsy, the doctor told my doctor that this person, she needs a lot of counseling before she does transplant, because listening to her, and she's a medic, it means she has a lot of denial. Going to a quack doctor, having denial in 2022, and then right now she questions everything. It means she needs a lot of counseling. So I would say dialysis has taught me that one can live with CKD. All you need is acceptance. Because let me tell you, when I accepted myself and I said, now this is it, I have CKD, I have kidney failure, there's nothing I can do about it, I have to live with it. That is when my life started to be better, because from that moment I started now talking to other fellow patients. I started going back to work, and again, even my skin started glowing, and I started adding weight. So I think the main point here is acceptance. Once you accept that you have it, things will be better. And don't listen to those things of spiritual, because I remember even that time I was in Citizen, so many pastors called me, even Pastor Ezekiel, that I can pray for you, your kidneys will get back to normal. At sister, there is no need of because my mom is the donor, there is no need of wasting your mom's kidney. Because what I've listened to your story, this is something spiritual, this is something cultural. You need to go back to your home and sijui slaughter a cow or something. And I remember my aunt telling me she had done all of that. She was taken sijui to my mother's, my father's side. She was told to slaughter a cow, to do sacrifice. She has sacrificed almost 3 times, and there was no difference. So, and then the pastors will tell you that your faith is low. You don't have faith. So they will tell you that they will rejuvenate your kidneys. But the point here is you need to have the right people. And as you said, Tabitha, that when you hear other patients talking about themselves, they have stayed on dialysis for 10 years, 20 years, you get encouraged. So you will not have that moment to go to that pastor. You will not have that moment to go to those cultural things, because of already you have had people who are giving testimonies that they have done all those things and nothing has changed. So I think doing community education, patient coming out and talking about themselves helps a lot, because that is what made me to open up. Because I said, if I changed because I listened to someone's story, maybe with my story talking about cultural, spiritual, it is going to change someone who is somewhere locking themselves up because they think it's the end of them, or they think it's cultural, and they won't have that space to to open up to those pastors and those cultural people. Yeah.
Thank you so much, Shiko, for sharing that. And that one brings me to religious addiction. And you know, religious addiction is just an addiction like any other addiction. The way someone can get to alcohol, the way someone can get addicted to substance abuse. There are those people who are addicted to religion, such that if you are told, take this and drink, they'll take whatever they've been given by their religious leaders, and they will drink that, and they will believe that this is a solution for whatever they have been told by the man of God. So we say, even as you go to churches or to your religious leaders, go also with your brain. Don't just go alone. Go there with your brain. As much as you are there spiritually, be there physically, mentally, and be alert. Sometimes you can be manipulated without knowing you are being manipulated. And I usually tell my patients that even if you are prayed for and you're told you have been healed, I know yes, it is by faith, but remember, if those creatinines are not normal, if the doctor has not confirmed that your creatinines are okay, to the laboratory test, or maybe wherever you've been going for testing, and they have confirmed no, you are okay, kindly do not miss your dialysis. Because if you miss your dialysis, chances are your urine, your creatinine will be very high. You'll have that fluid overload, you get pulmonary edema, and you'll get even hyperkalemia and likely to die. And remember, Luke in the Bible was a doctor, and that is why God gave out that knowledge to the doctors, and even the knowledge of dialysis, God gave it out so that if any part of the body is not working and there is a solution, you need to take advantage of that solution that God
I'm not sure what happened to Tabitha. We lost her, but we're over a half an hour of the show. So we're going to see if Tabitha come back to finish that up, but we got to kind of wrap up the show shortly because we're over our time. We'll wait for Tabitha. Brother Moses, anything you want to say?
Came out in pattern and has been in pattern with other previous guests we've had. Brother Steve is about this issue of first landing on the wrong stepping stone. You either end up going to a herbalist, a quack doctor, name it. But then again, what makes it again more of warriors getting vulnerable to this kind of pattern is simply because of lack of knowledge. But then I want to encourage my sister that because Brother Steve Shiku is also a champion and a kidney health advocate. So we want to encourage you Shiku, to keep on fighting. As you advocate for yourself, you also advocate for others. And for sure, you will realize that those who seek knowledge and those who seek ignorance, the difference in terms of outcome in managing this disease is 2 worlds apart. So yes, I want to encourage you. I've been on dialysis for close to 10 years, and I'm also a kidney warrior. So I'm proud of you. She's back.
Yes, we have her back. Tabitha, please, you can finish what you were doing. We're over the show like 30 minutes. So if you could be brief, what you need to finish talking with Mary about, that would be appreciated.
Thank you so much, Mary. You've actually really shared a lot. And for any patient out there who is on dialysis or who has CKD, I'm saying follow your clinics, get counseling, educate yourself as much as possible about kidney disease, seek support. Also, you can join support group, accept, and kindly continue with your work. Do not stop working unless maybe your employer lays you off. And if they lay you off, you can look for alternative means of working. Maybe to ask you the final questions, Shiko, what are your hopes for the future? You're muted. You're muted.
Right
You're
now,
still mute.
and right now, I'm okay.
Yeah.
So I'm saying, right now, it's not like before. I'm so hopeful because I have I'm on my acceptance phase right now. And I would say even going to channel has helped me a lot in opening up. So right now I'm in my transplant process. The fact that I'm in my transplant process means that I have hope for the future. And my plan is, God willing, to get a transplant. And once I get a transplant, I feel I will be of so much help to the society, because the fact that I'm a nurse and I'm a patient at the same time, it's so good because when you tell a patient that you are in their shoes, they will listen you more than any other nurse. And probably in the future, I'll specialize with nephrology nurse. For better knowledge. And so far, I've been doing community awareness, and I'm planning even to go for channels, teaching people and creating awareness. Because apart from a kidney warrior, I'm also a heart warrior. Because even at 2 years, I was done open heart surgery. So the transplant will be my second surgery. So you see, when I go to Kenyatta and I go to those pediatric wards and I talk to those children who has lost hope, it's going to give them hope. Imagining that I had an open heart surgery when I was small, and right now, maybe God willing, I have done transplant and I'm okay, I'm a nurse. It's going to give a lot of hope, because so far I have not. I started kidney awareness like 4 months ago, and I have seen results, good results. People are responding well. There are so many people who have gone to seek treatment because of my education. So we hope by the time we are doing your future is bright, because if Moses has done dialysis 10 years and right now he's a kidney ambassador, then it means there is hope. And again, Steve, in Kenya, so many people, the fact that people go to seek treatment when they are in their end stage. So we are trying to prevent that. At least if we can teach people on prevention, uh, it will prevent a lot of people from going for dialysis, and they can get conservative management. And for example, let me take like 2 minutes to teach that. Like for example, people who are diabetic or they have high blood pressure,
Take me
they can
out.
manage that to prevent it from getting into dialysis. So we are talking so much on prevention everywhere. Yeah, because at right now, so much people are on dialysis, and even the county government cannot be able to manage 3 sessions. So as for now, we are paid for 2 sessions in dialysis. Yeah. So I think if God, I think there is a purpose God saved me, and that's what my mom told me. And I'm grateful to my mom because she's my caregiver and she's going to be my donor. She told me that there is a reason God saved you when you were small, and there is a reason God took you to medical school, and then there is a reason God saved you when you are about to be killed by that quack doctor. Because that quack doctor destroyed me so much, and if I had not gone to hospital at that moment, I would have been dead. So I believe there is a reason God saved me twice. And I think we're going to work with people like Akina Tabitha and Moses to create prevention and awareness. Yeah.
All right, Tabitha, we have you back. Any last words or questions before we end the show?
Thank you so much, Mary. In the interest,
I don't know what's happening with Tabitha, but we're going to go ahead and thank Mary for coming on the show. This has been an unforgettable and powerful conversation. This has been on Kidney Hub East Africa. Tonight, we have heard a story of pain, denial, heartbreak, and a survival, but most importantly, a story of strength. To our guest, Mary Shiku, thank you for your courage, your honesty, and your willingness to share a journey that so many need to hear. Your voice is not just a testimony, it is a warning, a lesson, and a beacon of hope. And to my co-host, Moses Kennedy, aka the Kidney Ambassador, and renal nurse Tabitha Matikwa, which is having internet issues, thank you for standing with us in this important mission. And to everyone watching and listening, let this conversation stay with you. Let it remind you that kidney disease is real, that early action matters, and that your life is precious. Do not wait. Do not ignore the signs. Do not let fear silence your health. Until next time, this has been Kidney Hub East Africa, where awareness meets hope. Take care, stay informed, and keep supporting the kidney community. Peace. Mary, thank you so much for joining us again. Brother Moses, it's been a great show. Thank you for joining. And we have Sister Tabitha. I'm just going to add her and end the show. Let me see. She was in the lobby. Seems like she's having, again, issues with her internet. So we're going to leave it as that. Oh, there you go. Tabitha, any last words? We're about to end the show right now. Tabitha, can you hear me? All right. It looks like she's having some internet difficulty. So everyone, take care. We see you next week. Again, this has been Kidney Hub East Africa. All right. Take care, everyone.